Hello again, Jared Pitts here, and today we're going to be reading another article by Dr. Ray Peat. This one you can find on his website, raypeat.com, under the article section, and this one is called Thyroid, Insomnia, and the Insanities, Commonalities in Disease. And it starts off with some factors in stress, insomnia, and the brain syndromes. And so I love reading his research on thyroid because it is so pertinent to energy creation, and I cannot, turn anywhere without finding someone who is having some serious energy creation issues. So, this is how it goes. Serotonin, an important mediator of stress, shock, and inflammation, is a vasoconstrictor that impairs circulation in a great variety of circumstances. And I just want to point out something here real quick, that it says it's an important mediator of stress, right? And so the problem happens when we are in a chronic state of stress. And so these things that should be acute, our body, makes it happen, and then it should be done. But we're in this chronic state of stress, and so we create this, never-ending energy creation, suppression, and obviously you will have issues from that. So, continuing on. Stress impairs metabolism, and serotonin suppresses mitochondrial energy production. Stress and shock tend to increase our absorption of bacterial endotoxin from the intestine, and endotoxin causes the release of serotonin from platelets in the blood. Schizophrenia is one outcome of stress, both cumulative and acute. Prenatal stress commonly predisposes a person to develop schizophrenia at a later age. Serotonin's restriction of circulation to the uterus is a major factor in toxemia of pregnancy and related complications of pregnancy. Hypothyroidism increases serotonin activity in the body as it increases estrogen dominance. Estrogen inhibits the enzyme monoamino oxidase, or MAO, and is highly associated with increased serotonin activity. Progesterone has the opposite effect on MAO. Okay, so I'm sure a lot of you recently have seen the interview with Joe Rogan and Mel Gibson, and outside of that, I'm sure you've seen methylene blue come up over and over. And so, anyway, this just to bring it up, this is probably another place you're going to see this monoamino oxidase inhibitor, and because methylene blue is that. And so methylene blue at some amount, I don't know at what amount, maybe even, I guess it's just a matter of at what point is it a problem, but it is also a monoamino oxidase inhibitor. Thus, if you have too much of it, or if you're doing other things that are increasing the amount of serotonin in your body, and you also take methylene blue, there's a warning that it could cause serotonin syndrome. So, something to be aware of. I personally have taken methylene blue, and I take it here and there for different reasons. But anyway, just something to be aware of. Continuing. The frontal lobes of the brain are hypo-metabolic in schizophrenia. Serotonin can cause vasoconstriction in the brain. Serotonin release causes lipid peroxidation. And you'll see that phrase, lipid peroxidation, lipid being fat. So you're going to see this a lot in terms, or with Ray Peat, in terms of lipofuscin. You'll see lipofuscin and these age spots. People call them age spots or liver spots on people's skin. That is an external, something we can see from the outside, that lipid peroxidation is happening. Okay, schizophrenics have high levels of lipid peroxidation. All right, so whatever we see on the outside, you can better believe it's on the inside as well. Antioxidants, including uric acid, are deficient in schizophrenics. Therapies which improve mitochondrial respiration alleviate the symptoms of schizophrenia. Okay, so mitochondrial respiration, what does that mean? Essentially, it's energy creation. Okay, if you've listened to Ray Peat or Georgi Dinkoff or any of these people that are well versed in physiology, then you're going to hear them talk about oxidative phosphorylation, which is essentially mitochondrial respiration, what we're talking about here, the ability to create energy. And if you improve your body's ability to create energy, then you're going to have improved health. Again, continuing on, energy depletion leads to brain atrophy. But with normal stimulation and nutrition, even adult brains can grow. And I know I'm interrupting this article a lot here, but so much information here. And most of the allopathic medical field has this idea that even, very early on in our lives, late 20s, 30s, that somehow we can't change our body and improve our health, that our brains are stuck in some type of cemented form that can't be altered. But, with everything that the whole medical field says, so much more is possible, even later in life. So don't believe that, you're stuck where you're at. No matter what your age is, you can grow. Schizophrenics and depressed people have defective sleep. Increasing the body's energy level and temperature improves the quality of sleep. And again, if you've read anything on thyroid and Dr. Peat's research, then you'll see that body temperature, basal body temperature, is very much a better indicator of thyroid function, of energy creation, of our body's health than most of these tests out there. Okay, going on to the main bulk of this article. Everyone is familiar with the problem of defining insanity, in the case of people who plead innocent by reason of insanity. The official definition of insanity in criminal law is the inability to tell right from wrong. Obviously, that can't be generalized to everyday life, because any sane person realizes that certainty is impossible, and that most situations, including elections, offer you at best the choice of the lesser of two evils, or the opportunity to do the right thing, and to throw your vote away. All of these being in quotes, of course. People who persist in doing what they know is really right are eccentric, in the sense that they don't adapt to society's norms. In a society that chooses to destroy ecosystems rather than adapting to them, the question of sanity should be an everyday political issue. The use of medical terms tends to give authority to the people who are in charge of defining the terms, and it can give the impression of objectivity when there really isn't any scientific validity behind the terms. In their historical senses, quote-unquote crazy or flawed and insane or unsound are probably more objective terms than the medically invented terms dementia, praecox or premature idiocy, or schizophrenia, meaning divided mind. Quote-unquote odd speech is one of the dimensions used in the diagnosis of insanity. I am reminded of William Wordsworth's dismissal of William Blake as insane after failing to understand some of Blake's poems. Wordsworth was conventional enough to become England's poet laureate, and to his limited perspective, Blake's clear verses were incomprehensibly odd. Whenever a trusted government employee decides to blow the whistle on criminal activities, his agency invariably puts out the information that this now discharged employee is psychologically unbalanced. Dissent, in other words, is easy to dispose of by psychiatric tainting. And if you want a rabbit hole to go down, then I suggest looking into how the DSM-5 is created, edited, what actually goes into that. Very questionable. Very questionable. Okay, moving on. If we are going to speak of mental impairment, then we should have objective measures of what we are talking about. Blake unquestionably could do anything better than Wordsworth, because he was neither stupid nor dishonest. And it's almost a rule that ordinary employees are more competent than the administrators who evaluate their work. Objective standards of mental impairment would be more popular among patients than among diagnosticians, judges, and lawmakers. In a famous test of the objectivity of diagnosis, a filmed interview with a patient was shown to British and U.S. psychiatrists. 69% of the Americans diagnosed the patient as schizophrenic, but only 2% of the British psychiatrists did. The strictly medical/psychological definition of insanity is still, despite the existence of the International Classification of Diseases, and in the U.S., the Diagnostic and Statistical Manual, right, the DSM, which enumerate a large number of quote-unquote mental disorders, a crazily indefinite grouping of symptoms, and hasn't made diagnosis more objective. For example, in the last 30 years, autism has been separated from childhood schizophrenia, but now the tendency is for both of them to be called developmental brain disorders. Both schizophrenia and autism are now often described in terms of a spectrum of conditions, which hardly matters since they are not understood in terms of cause, prevention, or cure. The problem is in the history of psychosis as a medical idea. About 100 years ago, attempts were made to classify psychoses by their symptoms, unifying a great variety of old diagnostic categories into two groups: manic depressive mood disorders and dementia praecox, or schizophrenia, which, as indicated by its name, premature dementia, was considered to be progressive and incurable. Several kinds of mental disorders were found to have clear causes, including vitamin deficiencies and various poisons and infections. But the idea of a certain thing called schizophrenia still persists. The unitary concept of psychosis grew up in a culture in which endogenous insanity was a hereditary taint that for a time was quote-unquote treated by imprisonment, and that more recently has been treated with sterilization or euthanasia to eliminate the quote-unquote insanity genes. The idea that the disease is quote-unquote in the genes now serves the drug industry well, since they offer chemicals that will correct the specific quote-unquote chemical error. Not all psychiatrists and psychologists subscribe to the idea of a unitary psychosis, defined by a variety of symptoms. A positive contribution by Freudian psychoanalysis and its congeners and competitors was that it made people think in terms of causes and the possibility of cures, instead of hopelessness, stigmatization, isolation, and eradication. Although Freud expressed the thought that biological causes and cures would eventually be found, the profession he founded was not sympathetic to the idea of physiological therapies. Looking for general physiological problems behind the various symptoms is very different from the practice of classifying the insanities according to their symptoms, and the hypothetical quote-unquote brain chemicals that are believed to quote-unquote cause the symptoms. The fact that some patients hallucinate caused many psychiatrists to believe that hallucinogenic chemicals interfering with nerve transmitter substances such as dopamine or serotonin were going to provide insight into psychotic states. The dopamine excess or serotonin deficiency theories developed at a time when only a few transmitter substances were known, and when they were thought to act as very specific on-off nerve switches rather than as links in metabolic networks. The drug industry helps to keep those ideas alive. The idea that the brain is like a computer and that the nerves are like wires and switches is behind all of the theories about transmitter substances and synapses. If this metaphor about the nature of the brain and the organism is fundamentally wrong, then the theories of schizophrenia based on nerve transmitter substances can hardly be right. Another theory of schizophrenia, based on the computer metaphor, has to do with the idea that nerve cells' wire-like and switch-like functions depend on their membranes. And in the most popular version, that these all-important membranes are made of fish oil. The supporting evidence is supposed to be that the fish oil-like fatty acids are depleted from the tissues of schizophrenics. Just looking at that point, the quote-unquote evidence is more likely to be the result of stress, which depletes unsaturated fatty acids, especially of the specified type, in producing lipid peroxides and other toxic molecules. In one of its variations, the quote-unquote essential fatty acid deficiency doctrine suggests that a certain prostaglandin deficiency is the cause of schizophrenia, but experiments have shown that an excess of that prostaglandin mimics the symptoms of psychosis. The drug industry's effect on the way the organism is commonly understood has been pervasively pathological. For example, the dogma about quote-unquote cell surface receptors has sometimes explicitly led people to say that the quote-unquote brain chemicals are active only at the surface of cells, and not inside the cells. The consequences of this mistake have been catastrophic. For example, serotonin's precursor, tryptophan, and the drugs called serotonin reuptake inhibitors, or SSRIs, and other serotonergic drugs, and serotonin itself are carcinogenic and or tumor promoters. Excessive serotonin is a major factor in kidney and heart failure, liver and lung disease, stroke, pituitary abnormalities, inflammatory diseases, practically every kind of sickness, at the beginning, middle, and end of life. In the brain, serotonin regulates circulation and mitochondrial function, temperature, respiration and appetite, alertness and learning, secretion of prolactin, growth hormones, and stress hormones, and participates in the most complex biochemical webs. But the pharmaceutical industry's myth has led people to believe that serotonin is the chemical of happiness, and that tryptophan is its benign nutritional precursor, and that they are going to harmlessly influence the quote-unquote receptors on nerve membranes. A particular drug has many effects other than those that are commonly recognized as its quote-unquote mechanism of action. But when an antidepressant or a tranquilizer or a serotonin reuptake inhibitor alleviates a particular condition, some people argue that the condition must have been caused by the quote-unquote specific chemistry that the drug is thought to affect. Because of the computer metaphor for the brain, these effects are commonly thought to be primarily in the synapses, the membranes, and the transmitter chemicals. The argument for a genetic cause of schizophrenia relies heavily on twin studies in which the frequency of both twins being schizophrenic is contrasted to the normal incidence of schizophrenia in the population, which is usually about 1%. There is a concordance of 30 to 40% between monozygotic or identical twins, and of 5 to 10% concordance between fraternal twins. And both of these rates are higher than that of other siblings in the same family. That argument neglects the closer similarity of the intrauterine conditions experienced by twins. For example, the sharing of the same placenta and experiencing more concordant biochemical interactions between fetus and mother. So just looking back at that, I know that could have just kind of strung together, but like it's showing, if you have identical twins coming in at 30 to 40%, and then fraternal twins being 5 to 10%, you can see how identical twins having that more intimate intrauterine experience, you can see how that higher percentage might make sense. Okay, moving on. Defects of the brain, head, face, and even hands and fingerprints are seen more frequently in the genetically identical twin who later develops schizophrenia than the twin who doesn't develop schizophrenia. Of the twins, it is the baby with the lower birth weight and head size that is at a greater risk of developing schizophrenia. Oliver Gilley, in his book, Who Do You Think You Are?, discussed some of the fraud that has occurred in twin studies. But no additional fraud is needed when the non-genetic explanation is simply ignored and excluded from discussion. The editors of most medical and scientific journals are so convinced of the reality of genetic determination that they won't allow their readers to see criticisms of it. Prenatal malnutrition or hormonal stress and other stresses are known to damage the brain, and especially its most highly evolved and metabolically active frontal lobes, and to reduce its growth relative to the rest of the body. The standard medical explanation for the association of pregnancy toxemia and eclampsia with birth defects has been, until recently, that both mother and child were genetically inferior, and that the defective child created the pregnancy sickness. The same reasoning has been invoked to explain the association of birth complications with later disease. The defective baby was the cause of a difficult birth. That argument has recently been discredited, and there's a study there by McNeil and Cantor Gray, 1999. Schizophrenics are known to have had a higher rate of obstetrical complications, including oxygen deprivation and cesarean deliveries, than normal people. Like people with Alzheimer's disease, the circumference of their heads at birth was small in proportion to their body weight and gestational age. Animal studies show that perinatal brain problems tend to persist, influencing the brain's metabolism and function in adulthood. Like the other major brain diseases, schizophrenia involves a low metabolic rate in crucial parts of the brain. In schizophrenics, hypofrontality, low metabolism of the frontal lobes, is characteristic, along with abnormal balance between the hemispheres and other regional imbalances. A very important form of prenatal stress occurs in toxemia and preeclampsia, in which estrogen is dominant and endotoxin and serotonin create a stress reaction with hypertension and impaired blood circulation to the uterus and placenta. The brain, just like any organ or tissue, is an energy-producing metabolic system, and its oxidative metabolism is extremely intense, and it is more dependent on oxygen for continuous, normal functioning than any other organ. Without oxygen, its characteristic functioning, consciousness, stops instantly. When blood flow stops, blindness begins in about 3 seconds, and other responses stop after a few more seconds. The concentration of ATP, which is called the cellular energy molecule, doesn't decrease immediately. Nothing detectable happens to the neurotransmitters, synapses, or membrane structures in this short period. Consciousness is a metabolic process that, in the computer metaphor, would be the flow of electrons itself, under the influence of an electromotive force, a complex but continuous sort of electromagnetic field. The computer metaphor would seem to have little to offer for understanding the brain. In this context, I think it's necessary for the present to ignore the diagnostic details, the endless variety of qualifications of the idea of quote-unquote schizophrenia that fill the literature. Those diagnostic concepts seem to tempt people to look for the precise cause of this particular subcategory of schizophrenia, and to believe that a specific drug or combination of drugs will be found to treat it, while encouraging them to ignore the patient's physiology and history. If we use the standard medical terms at all, it should be with the recognition that they are, in their present and historical form, not scientifically meaningful. The idea that schizophrenia is a disease in itself tends to distract attention from the things it has in common with Alzheimer's disease, autism, depression, mania, the manic depressive syndrome, the hyperactivity attention deficit syndrome, and many other physical and mental problems. When brain abnormalities are found in schizophrenics, but not in their normal siblings, it could be tempting to see the abnormalities as the cause of schizophrenia, unless we see similar abnormalities in a variety of sicknesses. For the present, it's best to think first in the most general terms possible, such as brain stress syndrome, which will include brain aging, stroke, altitude sickness, seizures, malnutrition, poisoning, the despair brought on by inescapable stress, and insomnia, which are relatively free of culturally arbitrary definitions. Difficulty in learning, remembering, and analyzing are objective enough that it could be useful to see what they have to do with brain stress syndrome. Stress damages the energy-producing systems of cells, especially the aerobic mitochondria, in many ways, and this damage can often be repaired. The insanities that are most often called schizophrenia tend to occur in late adolescence or around menopause, or in old age, which are times of stress, especially hormonal stress. Postpartum psychosis often has features that resemble schizophrenia. Although the prenatal factors that predispose a person toward the brain stress syndrome and those that trigger specific symptoms later in life might seem to be utterly different, the hormonal and biochemical reactions are probably closely related, involving the adaptive responses of various functional systems to the problem of insufficient adaptive ability and inadequate energy. By considering cellular energy production, local blood flow, and the systemic support system, we can get insight into some of the biochemical events that are involved in therapies that are sometimes successful. A unified concept of health and disease will help to understand both the origins and the appropriate treatments for a great variety of brain stress syndromes. The simple availability of oxygen and the ability to use it are regulated by carbon dioxide and serotonin, which act in opposite directions. Carbon dioxide inhibits the release of serotonin. Carbon dioxide and serotonin are regulated most importantly by thyroid function. Hypothyroidism is characterized by increased levels of both noradrenaline and serotonin, and of other stress-related hormones, including cortisol and estrogen. Estrogen shifts the balance of the quote-unquote neurotransmitters in the same direction, toward increased serotonin and adrenaline, for example by inhibiting enzymes that degrade the monoamine neurotransmitters. When an animal such as a squirrel approaches hibernation and is producing less carbon dioxide, the decrease in carbon dioxide releases serotonin, which slows respiration, lowers temperature, suppresses appetite, and produces torpor. But in energy-deprived humans, increases of adrenaline oppose the hibernation reaction, alter energy production and the ability to relax, and to sleep deeply and with restorative effect. In several ways, torpor is the opposite of sleep. Rapid eye movement, or REM, that occurs at intervals during sleep and in association with increased respiration, disappears when the brain of a hibernating animal falls below a certain temperature. But torpor isn't like non-REM deep sleep, and in fact seems to be like wakefulness, in the sense that a sleep debt is incurred. Hibernating animals periodically come out of torpor so they can sleep, and in those periods, when their temperature rises sharply, they have a very high percentage of deep, slow-wave sleep. Although it is common to speak of sleep and hibernation as variations on the theme of economizing on energy expenditure, I suspect that nocturnal sleep has the special function of minimizing the stress of darkness itself, and that it has subsidiary functions, including its now well-confirmed role in the consolidation and organization of memory. This view of sleep is consistent with observations that disturbed sleep is associated with obesity, and that torpor hibernation chemical, serotonin, powerfully interferes with learning. Babies spend most of their time sleeping, and during life the amount of time spent sleeping decreases, with nightly sleeping time decreasing by about half an hour per decade after middle age. Babies have an extremely high metabolic rate and a stable temperature. With age, the metabolic rate progressively declines, and as a result, the ability to maintain an adequate body temperature tends to decrease with aging. The simple fact that body temperature regulates all organic functions, including brain waves, is habitually overlooked. The actions of a drug on brain waves, for example, may be mediated by its effects on body temperature. But this wouldn't be very interesting to pharmacologists looking for quote-unquote transmitter-specific drugs. Torpor is the opposite of restful sleep, and with aging, depression, hypothyroidism, and a variety of brain syndromes, sleep tends toward the hypothermic torpor. An individual cell behaves analogously to the whole person. A baby's high-energy resting state is paralleled by the stable condition of a cell that is abundantly charged with energy. ATP and carbon dioxide are at high levels in these cells. Progesterone's effects on nerve cells, including favoring the high-energy resting state, and this is closely involved in progesterone's thermogenic effect, in which it raises the temperature set point. The basal metabolic rate, which is mainly governed by thyroid, roughly corresponds to the average body temperature. However, in hypothyroidism, there is an adaptive increase in the activity of the sympathetic nervous system, producing more adrenaline, which helps to maintain body temperature by causing vasoconstriction in the skin. In aging, menopause, and various stressful conditions, the increased adrenaline and the increased cortisol production, which is produced by excess adrenaline, causes a tendency to wake more easily and to have less restful sleep. While the early morning body temperature will sometimes be low in hypothyroidism, I have found many exceptions to this. In protein deficiency, sodium deficiency, in menopause with flushing symptoms, and in both phases of the manic depression cycle. And in some schizophrenics, the morning temperature is high, corresponding to very high levels of adrenaline and cortisol. Taking the temperature before and after breakfast will show a reduction of temperature, the opposite of what occurs in simple hypothyroidism, because raising the blood sugar permits the adrenaline and cortisol to fall. The characteristic sleep pattern of hypothyroidism and old age is similar to the pattern seen in schizophrenia and depression, a decrease of deep, slow-wave sleep. Serotonin, like torpor, produces a similar effect. In other words, a torpor-like state can be seen in all of these brain stress states. Several studies have found that anti-serotonin drugs improve sleep and also reduce symptoms of schizophrenia and depression. It is common for the neuroleptic drugs to raise body temperature, even pathologically, as in the neuroleptic malignant syndrome. In old people who lose heat easily during the day, their extreme increase in the compensatory, nervous, and hormonal adrenaline activity causes their nighttime heat regulation, vasoconstriction in the extremities, to rise to normal. Increased body temperature improves sleep, especially the deep, slow-wave sleep. A hot bath or even warming the feet has the same effect as thyroid in improving sleep. Salty and sugary foods taken at bedtime or during the night help to improve the quality and duration of sleep. Both salt and sugar lower the adrenaline level, and both tend to raise the body temperature. And I know a lot of people, this is my thoughts here, get the whole, orange juice with some salt in it from what Dr. Peat is saying here. So people will either drink a good glass of orange juice with a good bit of salt in there right before bed, and they'll even have it on their nightstand next to their bed so that if they wake up in the night, they can drink some. And it is amazing what this little thing can do for people's sleep patterns. So something to look into there. Hypothyroidism tends to cause the blood and other body fluids to be deficient in both sodium and glucose. Consuming salty carbohydrate foods momentarily makes up to some extent for the thyroid deficiency. In the periodic table of the elements, lithium is immediately above sodium, meaning that it has the chemical properties of sodium, but with a smaller atomic radius, which makes its electrical charge more intense. Its physiological effects are so close to sodium's that we can get clues to sodium's actions by watching what lithium does. Chronic consumption of lithium blocks the release of adrenaline from the adrenal glands, and it also has extensive anti-serotonin effects, inhibiting its release from some sites and blocking its actions at others. Lithium forms a complex with the ammonia molecule, and since the ammonia molecule mimics the effects of serotonin, especially in fatigue, this could be involved in lithium's anti-serotonergic effects. Ammonia, like serotonin, impairs mitochondrial energy production. At a minimum, it uses energy in being converted to urea. So anti-ammonia, anti-serotonin agents make more energy available for adaptation. Lithium has been demonstrated to restore the energy metabolism of mitochondria, and there's a study there. Therapies that have been successful in treating schizophrenia include penicillin, sleep therapy, hyperbaric oxygen, carbon dioxide therapy, thyroid, acetazolamide, lithium, and vitamins. These all make fundamental contributions to the restoration of biological energy. Antibiotics, for example, lower endotoxin formation in the intestine, protect against the induction by endotoxin of serotonin, histamine, estrogen, and cortisol. Acetazolamide causes the tissues to retain carbon dioxide, and increased carbon dioxide acidifies cells, preventing serotonin secretion. So a lot in that article. Again, you can see we have quite a few references here. You can go through those on your own time. Dr. Peat references everything that he researches, so usually the references portion is a lot bigger than the actual content that he's put together for us here. But I just want to point out, it's not just this whole natural versus allopathic medicine dichotomy. It's not these two separate things, right? Antibiotics, right here. Antibiotics can be helpful, and it is important to look into what type of antibiotics and how much, and so there's communities out there where people bounce ideas off of each other, even Facebook groups and things like this. But I would highly, encourage, I'm not a doctor, I don't recommend anything. None of this is meant to be, diagnosing or recommending, just helping you in your health journey. But I highly encourage you to find some groups out there, see what people are doing for their issues, and you can find a lot related to Ray Peat. Look on, x.com, formerly Twitter. I gotta say it. But you'll find a lot of communities, a lot of people willing to help you troubleshoot what you're doing. And, this is something that Dr. Peat always impressed upon people, that we are not these static form. Like, don't get so stuck in a way of thinking that you are not open to something new, right? And this is an example in my own health journey. Antibiotics, right? For years, I thought of them as this, this evil thing that you should never use. And then Dr. Peat opened my eyes, opened my mind to the idea that maybe we don't have to be so dogmatic about all of this. There's so much about this in the Bible, about not having the eyes to see, right? Not having the ears to hear. And so there's a difference between listening and hearing, right? You have to be able to take something for what it is and not be so stuck in your ways that hearing that, wow, antibiotics might be helpful for my health, if that offends you personally, well, maybe this isn't about facts. Maybe this is about some type of dogmatic, religion that you've become a part of. This health religion. Anyway, I'll get off my soapbox. I hope this was helpful for you guys. I hope you found some information in here. There's a lot, and I know we're all just piecing things together, but even if you got something really small out of this, I hope you did, and I hope you share it with someone who needs this. You'll have a good one. Until next time, God bless.